Stimulo, you've just been resurfaced, and Stimulo is to tighten any areas but also resurface any areas. So it's more about the resurfacing. So they might have done it around your eyes, they might have done it on your hands, they might have done it on your décolletage for the fine lines, they might have done it on sun patches or anything like that. The reason why they're doing it, especially in this area, is to tighten the skin, because it's very difficult to tighten the skin with Botox. It's easy to reduce the fine lines, but it's difficult to tighten the skin. So it's like an upper blepharoplasty or a lower blepharoplasty without going through the surgery. So what's going to happen now is you have to follow what they've told you in the aftercare. Wherever they've done the Instimulo procedure, you will be red and swollen for the next couple of days. What's going to also happen is they're going to ask you to take an antihistamine for the next 1 or 2 days. You can carry on for a couple more days if you'd like. The longer you ice the area wherever you have Instimulo, the quicker the healing of that procedure, firstly. Secondly, what also happens is you'll notice that you'll get darkening dry patches in some areas depending on the strength they're using. So if you've just got a few fine lines, it might go a little bit lighter, but if you really need a lift, or if you really need resurfacing and complete erasing of those fine lines in the décolletage or on the hands, they will go a little bit harder. So the skin is going to dry and crisp a little bit, and it might be a little bit itchy, and that's why we say take the antihistamine. Do not peel it off. It will eventually flake off. The worst thing you can do is peel this skin off, because you will cause scarring in the long term. So don't do it before an event that you have to go out in. Always have 7 to 10 days downtime just in case. With the eyes, you will be swollen that same day, and then the swelling will reduce the next day, but it will be red around the area. And everything else you can cover for the treatment. You can apply a little bit of serum that they might give you. You can apply a little bit of Vaseline around the eye that if they don't give you the serum. But other than that, the result will be phenomenal by day 7 to 10. You will have that tightening. You may need a few sessions under the eyes because the skin is always lax and more loose in this area of the face. It's more precious, but you should be happy. And any concerns or any questions you have, again, always contact your aesthetic lead or contact the LMS concierge team.